I'm Tamara, and this is TELUS Talks with Tamara Taggart. We're bringing together experts, thinkers, and leaders, busting myths, sharing stories, and staying connected when Canadians need it the most. We're having unexpected conversations for unprecedented times. Hi, Juggy, how are you?
I'm great. Hi, Tamara. How are you?
I'm good. Yeah. So listen, I was doing a little bit of homework on you, and I was watching some videos and of you speaking at different health symposiums and conferences. And the thing that became really clear to me is how passionate you are about health. And you know, I've seen a lot of people speak, and I consider myself a little bit of an expert when it comes
You
to
are,
public speaking.
of course.
Well, no, and I really can. I know when someone is speaking from a real place. I just don't know what your story is. So that's where I want to start. I want to know, like, I think you've been with TELUS for
Quarter of
a
a
million
century.
years,
Yeah.
a quarter of a century. Yes. So, you know, there was no TELUS Health 25 years ago.
No.
So I don't know. There's a story here, and I want to know what it is.
Sure. Yeah, there is a story in terms of why I'm involved in health, I think is what you're asking. But yeah, there's a story. I have been really lucky to have had a pretty fantastic, a number of careers with this organization over a long period of time. I grew up in this company and you know did some pretty exciting stuff. Was really fortunate to get a lot of opportunities to do some interesting things. And then I think it was now 10 years ago. Uh, it happened that my mom, Tamara, is the most motivating force in my life and always has been. And she's the kindest and most optimistic person. She's very healthy. She was vegetarian before anyone even thought about it, and all of those things. Anyway, and I hope to be as kind as she is. But anyway, what happened about 10 years ago is she started to experience some symptoms. She checked herself in the hospital. I remember I was at the airport coming back from some training that I was on, and I was talking to her, and she's like, I just don't feel right. And it was on a Good Friday. And so she said, I'm just going to go get checked out at the hospital because her doctor wasn't available. And so she went to the hospital, and I was flying back. And so when I got back to Vancouver, I met her at the hospital, and they started to do a whole bunch of tests. And they said, oh, we think that, she's probably got indigestion. She had some interesting symptoms. And they said, well, we think it's probably just indigestion. And, we're going to run these tests, et cetera, et cetera. And then they ran the test and they said, yeah, we think it's indigestion. And my mom said, I don't feel right though. Like, it doesn't feel like indigestion. Then they ran one of their last tests, and I had actually been putting all her clothes in a bag and we're ready to go and feeling happy and relieved that it's nothing serious. But at the same time, looking at her, and she's like, something's not right still. And in her intuition was kicking in for sure. What they did then was they ran this one last test called the troponin test, which talks to you about how many what your heart enzymes are doing, and the enzymes that are damaging heart muscle, and whether or not they're being released in the system. And the very last test, they said, it's just a formality, last test, and then you guys can go. And then they came back and said she's actually having a heart attack.
Oh, wow.
Yeah. And so we were getting discharged just before that with indigestion as a diagnosis. So she was having a heart attack. And so my mom doesn't have any other, health issues or ailments or things of that nature. So it came as a shock. What happened next was probably even worse, was that they told us, because it was a holiday, that they didn't have the cath lab in to do the emergency angioplasty that she needed to have. And so, we were shocked, right? She's having a heart attack. She needs to get the angioplasty done, and it's on Good Friday because it's a holiday. They're not here. And so I said, well, can we transfer her to another hospital? They said, no, that's not possible. You're going to have to wait until probably Tuesday or Wednesday of next week to get the angioplasty that she needs. And so I sat back, and, I've always been really proud of the Canadian healthcare system, the fact that we can get access to it. And I think we look at other places around the world and we think, wow, aren't we so lucky? And I sat back and I felt the most helpless that I've ever felt in terms of being able to help my family with a situation that they're dealing with. And I started calling people that I knew, ran into some walls. Then finally, I came upon someone who said, let me look into this. They found out that actually my mom could get transferred. She was going to get transferred to VGH at that point in time. And she was going to get the angioplasty that she needed. They were going to be bringing the lab in to help her. And so my mom is all of a sudden, when nothing was going to happen, then everything was actually happening. And I felt at that time relief that mom was going to get the help she needed, but at the same time felt it's not right. Like all Canadians should have access to this. And she wasn't feeling good about it. She said, well, what about all the other families that are waiting? And what about them? And I'm like, Mom, when you're going to get moved there, the other people that are waiting, they're going to get the same treatment too. And so because of you, the other people are also going to be helped. And please just relax and get the help that you need. And so she did. And they found that her artery was 100% clogged. It absolutely needed the emergency angioplasty. That transfer, saved her life. And after that, I thought, okay, so I've had a great career here. I think that other people need to benefit the same way that we did. And the system does need to get help. And how can I help? So I thought one of three things I have to do. I either have to go back to school and become a doctor. Maybe I'll be able to help people one by one. It would take me some time, but I think I could do it. A second thing is maybe I can get involved on the political or government side and help on the bureaucratic side to change some of these policies that are impacting, people's access to healthcare. And then third, I thought, wait a minute, we have a division within TELUS called TELUS Health. I'm already here. Maybe there's something that I can do in that regard to help change access to healthcare for all Canadians. And so that's what I did. I then decided I thought my job and my career have been great to me. I've learned a lot, but it has to mean more. And I need to now dedicate this next phase of my life doing that. And so then I moved into the TELUS Health side of our business. And I've been, working hard, trying to change access to healthcare for Canadians so that they can benefit. And I'll tell you, it was on Good Friday. We launched our service, our Babylon by TELUS Health service, a year ago now. And on Good Friday morning, I checked, and as I check every day, I checked to see how quickly can somebody see a doctor if they need to see a doctor right now. And it was 9:00 in the morning, and it was 12 minutes away that they could see a doctor if they needed to on a holiday. So that was pretty important moment for me on my journey to really help, transform and revolutionize access to healthcare for all Canadians. That's my story.
Yeah, well, it's quite a story. And, we all have a health story, right? Every single person has a health story. We all have, it is, we are nothing if we don't have our health, right? And none of us get through this life unscathed. So
that's right.
There's always a lot going on. And I also, this is the TELUS Talks with Tamara Taggart podcast. And yes, you, Juggy, you work for TELUS, but nobody's telling me what questions to ask you. This isn't I wanted to talk to you because you're a bit of a legend, whereas you are because you're very passionate, and people who are passionate at what they do are the people, they create real change. And so that's why I wanted to chat with you about it, because, I think that those of us who were born and raised in BC, TELUS is always the phone company, and they have phones and your home phone, and it's really evolved. And there's this whole new, area of TELUS called TELUS Health. And it's not just Babylon. It's not just this virtual health idea. There's a lot more to it, isn't there?
Absolutely.
Where do you even start when you start telling people because here's the thing, you guys are not very good at telling people what you do. So let's share some of the things that you have been working on. Can I ask you about seniors? What's something, are you doing anything for seniors?
Oh yeah, we are. And we're just getting started. Thank you for asking all of that, Tamara. We're not new in the healthcare game. So I joined TELUS Health when I made that change after my mom. It's been almost 8 years now that I've been working in the healthcare side of our company. And we actually started TELUS Health about 12 years ago. We'd spent probably $3 billion building this secret business that people don't really know about. And we, you know what, we made a decision, and we said, and Darren Entwistle made this decision and said, look, healthcare and public healthcare right now in Canada needs help. And it's probably the most important challenge, a social challenge of this generation. And so instead of, buying sports companies or broadcasting or what have you, we're going to put a shoulder behind helping this public situation and helping the public sector with this problem, because we all stand to benefit. Society needs us to. And that's what we did. And so we now have, we're the largest healthcare IT company in Canada. And our focus and our mission is we want to revolutionize access to healthcare. And so and who better than us, the telecommunications company, who knows how to secure information, move information fast. And from a healthcare standpoint, we're going to make sure that the information gets into the right hands at the right time so that a right health outcome can be made. So whether it's electronic medical records, pharmacy management software, whether it's our virtual care services, which are a core part of our healthcare business, we've got a variety of products and services. And so when you come back to seniors, which is, again, very near and dear to my heart, I have another story on the senior side with my poor grandfather, who was quite sick with congestive heart failure. And, we were back and forth in and out of the hospital because that condition requires you to be monitored by doctors and healthcare providers. And then when I moved into TELUS, unfortunately, he passed from congestive heart failure, and, the end was pretty bleak. But now when I came onto the healthcare side of TELUS, we have something called home health monitoring. And I worked on that project with a number of talented individuals at TELUS. And what that is we allow people who have congestive heart failure or COPD, we give them the technology so that they can be monitored from home. We connect them to the doctors and nurses so that, they can check their vital signs every day and make sure that, their pulse oxygen levels are at the right level, that their weight is at the right level, their blood pressure is at the right level. And, we allow seniors, most of these people are seniors, we allow them to be, at home instead of in a home, Tamara. And I think that that's where people would want to be. And we let them do it with dignity and grace. And we make sure that that's there. We give them the hope that they need. Another product that we offer is called Living Well Companion. And this is a personal emergency response service designed for seniors. And again, to give seniors and caregivers like us peace of mind to know that, if seniors are at home and they're by themselves, and if they're worried about, falling ill or falling, the service will detect that. It's GPS enabled. We'll be able to dispatch emergency services to them 24/7. And again, people want to be at home and they want to live independently for as long as they can. And, digital health solutions like these allow them to do that. And I'm very proud and privileged to be part of an organization that is making this their mission and to helping at all levels of society. So seniors, chronically ill people, average people that are trying to get access to a doctor and might not have one. We have our mobile health clinics that are all across the country, bringing healthcare to.
Tell me a little bit about those. What does a mobile health unit do?
So a mobile health unit is a van equipped with doctors, our technology, and it's going to help vulnerable populations on the street and delivering healthcare when they need it, meeting them where they're at. And that's what we're doing across the country. We have, a variety of different partnerships with health authorities or charitable organizations that are trying to, they're joining us on our mission. We're putting our the best of us together and helping people on the streets get healthcare when they need it and where they need it. We can't expect everyone to just come to us from a healthcare standpoint. We have to bring healthcare solutions out to people.
Well, and the thing is, for a lot of people, they are very nervous or scared to go to a hospital or go to a doctor's office for whatever reasons they may have. So it's, absolutely. And aren't there millions of Canadians that don't have a family doctor?
Yes. There are 5 million Canadians that don't have access to a regular family doctor. And, the numbers in our province here in British Columbia are 800,000. It's about the same in Alberta. And, it's getting worse, not better. Being a GP and being a family doctor, it's hard. And, people are retiring. It's hard to find someone to take over your practice. And so I think we need to be looking at different ways of delivering healthcare. And the other piece of that, Tamara, is, not just for people who don't have a doctor. What do you do after 5 p.m. when you need healthcare support?
Mm.
Where do you go?
Well, yeah, I mean, yeah, health issues don't happen 9 to 5 usually.
No,
They
they
usually
don't.
happen, yeah.
After, and in
It's
my
very
case, they happen on a holiday where, there's even less staff available and you need healthcare support, or, and if you live in a remote community, maybe you see a family doctor once every 2 or 3 weeks. And, I hear stories about people saying that we used to have a family doctor, now we don't. And with Babylon by TELUS Health and with our virtual care services, we're bridging that gap. And so you can get access to a doctor, a family doctor, anytime you need to, including holidays and weekends and after hours.
Okay, so explain to me who are these doctors? So I use, if I use virtual health, I know that some doctors' offices are doing their own thing,
Yeah,
and
they
that's
are.
great if you have a family doctor.
Yeah.
If let's say it's 10 o'clock at night and I'm having an issue and I want to get a hold of a doctor. Who is this doctor? Are they a real doctor? Are they in the same province as me? Who
Yeah,
are they?
they are. And so we offer our service, Babylon by TELUS Health in British Columbia and Alberta. I've expanded to Ontario, and we're going to be taking this to other provinces really quickly here as well. And so they're all locally licensed doctors. These are doctors that are in your community. Now, in Vancouver, you might have a doctor, a Babylon by TELUS Health doctor that's located in Vancouver, or they could be on Vancouver Island. I mean, that's the beauty of the technology, that you could be anywhere, but you do need to be a locally licensed doctor to be a part of our Babylon by TELUS Health service. And that's who you're seeing. And I think that, one thing I would say is what's really important to us as we're delivering the service is the quality of the service has to meet the standards that we believe people can deserve to get. And so what that means is after every consultation you have with one of our Babylon by TELUS Health doctors, we get you to give us a rating. Tell us out of 5, how was this healthcare experience? Did it meet your needs? Did you get what you needed? Was the doctor compassionate? Did they take their time with you? And our average after thousands and thousands of consultations that we've now completed, the average, Tamara, is 4.9 out of 5 from all of those people. And I'm really proud of that. And that's the goal that we have. And we're going to keep making sure that we never, ever sacrifice the quality of the service, and we deliver healthcare the way that people want it.
Mm-hmm. Okay. So, I met you, we've only met in person once, and it was over a month ago. And after I chatted with you, I felt really inspired. And so I went and I loaded I went and loaded the app on my phone.
Thank you.
Well, you don't thank me yet, because I loaded it in, and then it came to the part where I had to put my information in.
Yes.
And I'm not going to lie, Juggy, I was a little nervous because, we're living in this digital age now, right?
Yeah.
And, I can load all kinds of apps from the App Store in, and they want to know what my this is or my that is.
Yeah.
I felt kind of weird about a health one. I was like, whoa, okay, so but then I thought to myself, well, I've been doing online banking for a long time.
Yes,
you know what I mean? And I do that from my phone.
Yeah.
So I can't be alone in this thought process of being a bit nervous with my personal information. So maybe you could talk a little bit about how safe is my information? Who owns my health records? Should I be worried that you're not going to sell them one day? Or,
Yeah.
I don't know.
I think those are all really valid. They're valid concerns. Those are real concerns that people have. And I think what's important to know are a few things. So one, we are a telecommunications company. We are in the business of protecting very sensitive data. And we have been in the business of doing that for years and years and years. Healthcare data is, also really important and very sensitive data. We meet or exceed the standards that are set for us at the federal level. So I think that that's important to understand. We have a privacy by design mindset. So it's not an afterthought. We are designing our products and services to meet or exceed those standards. Okay. The second thing I would say is your data is not on your phone. So you're submitting it. It's being stored securely, and we're storing that securely on your behalf in Canada. So it's not on your phone. So if you lose your phone, as an example, it would be terrible if you lose your phone. Okay. And TELUS has stuff that we can help you with on that front. But your data is not on your phone. So the data is being securely stored on your behalf, just like your banking information.
Right.
And you make a really good point, Tamara. Like our phones have become, I think, an extension of us in so many ways. And it's certainly become our wallet, hasn't it? And so you can pay for things using your phone. You can do online banking on your phone. You can do shopping on your phone. You should be able to conduct healthcare on your phone too. And you deserve to have the convenience of that. And you should know and trust that we are protecting your data, just like all of the other information that's flowing through it. Healthcare information is protected to the highest degree. And in terms of selling your data, we would never do that. And I think that, we have our policies lined very clearly. You can see the details of what we do with the data and where it is. It's your information, your health record and your health information. That's yours. And, even when you go see a doctor in a clinic or in a practice, those are your health records and you should have access to them. And I think that, another aspect of our service, which I think has been really compelling for people, is that we make sure that our doctors type plain notes for you to understand, right? So it's not in doctor speak, it's plain. And so after every consultation, those plain notes are in your file that you can reference at any time you need to. It'll talk about what you guys talked about, what the issues were, what the recommendation was. The video recording is also there for you if you need to consult that again. Think about how many times you go to a doctor and you forget what they told you.
All the time.
Right.
All the time.
Because you're probably anxious in why you're even there in the first place, right?
Yeah. Yeah. It's interesting because what you're talking about, it's a game changer, really. Like I'm thinking about, health crises that we've had in my own family, right?
Right.
It's slowly becoming a distant memory, but I had cancer like 8 years ago. And if I would have had access to this, to be able to get online and ask a doctor, okay, I've started this chemo drug. I'm throwing up all the time. Is this normal?
Right.
That would have really helped me, not only physically, but just what's happening in my brain, as I go to sleep and I'm worried about everything that's happening. And we know that there's millions of people that are going through, yes, we're in the middle of a pandemic, and it's horrible.
Yeah.
And virtual health has probably never been more important than it is right now.
Right.
And I think that's making it very clear to a lot of people. But other things aren't stopping, Juggy. Like people are still having heart problems. They're still dealing with cancer. They're still, people are diabetic and need to see a doctor or kidney failure, whatever it might be, right?
I know.
So as you're speaking about it, I really, have you been wondering what will virtual health look like after this pandemic? Like, because it's really made it apparent how important it is.
Yeah, how important it is and also how effective it can be. It doesn't work for everything. If you have an emergency situation, you need to go to the emergency rooms. And and you just mentioned it here too, in the pandemic right now, and I sit on the board for VGH and UBC Hospital Foundation. And what we're hearing is that people are worried about going into the ERs right now because of COVID and because of the crisis. And that's problematic if you are having an emergency and you're not wanting to go into the emergency room. So I encourage people, if you're worried, go, the hospitals are safe, go to the emergency room if you need to. Don't suffer. I think the other thing too is, what's really important about all of the digital health solutions that we're talking about is I really want people not to feel alone. So if you're suffering alone and where are you going? You might go to your friends or your family to talk about what you're worried about, or you might go to Dr. Google. Okay. And then when you go on the internet.
Yeah, well, we've all done that,
right?
And that's a problem.
It is. And then and of course you're going to find the rarest of the rarest of the rarest. And then you're going to think you have it. And then you're just going to worry more by yourself. So getting access to healthcare when and where you need it is critical. And these virtual healthcare solutions we're talking about, getting access to a doctor anytime you need to talk to them. If you can't get access to yours, if you're lucky enough to have a family doctor and you can't get access to them, use our service. And from a continuity of care perspective, which is really important to us, We'll make sure that the notes go to your family doctor if you want.
Mm,
If you consent to that, we will send the notes to your family doctor so that they can still be that quarterback for you, managing all aspects of your own health, right? And
right.
so many times I hear people saying, I was so worried, I didn't have anywhere to go, I didn't want to go to the ER, I suffered, my kids were sick, etc. You don't have to do that anymore. And I think after this pandemic is over, because it will be over, it will be behind
Yeah.
us. I think that people are going to realize that we can leverage technology. We can do it safely. We can experience the convenience that it offers us. And I think that will become commonplace, and as well it should. It won't work for everything, but it'll work for a lot. And before the pandemic started, I've never seen advocacy for any product or service the way that I see it for healthcare services and for our virtual care services specifically, because it's putting safely and in a managed way, it's putting the power and control back into your hands. When do
Mhm.
you want to see the doctor? What do you want to talk about? Do you want to go, review those notes again to make sure you understand it? Do you want to show your partner or your spouse or your caregiver or your child, what was discussed so that they can be part of your caregiving as well? You have access to do all of that now. And I think it will become commonplace as well. It should.
Yeah, and I agree with what you said about not feeling alone, right?
Yeah.
So when we were talking about seniors earlier, that's a real challenge for seniors because it can be very lonely. There are a lot of people that are on their own that aren't seniors. And then I was just thinking about, single moms or single dads who,
Yeah.
have 2, 3 kids, and it's not easy to pack everybody up and go to the
Of
doctor.
course
That
not.
is hard.
Of course not.
We've all done it, and well, not all of us, but you know what I mean. It's very difficult. So to have this option is really something. And it's, I guess, what I'm listening to, what I'm hearing is this isn't the answer to everything,
No.
but it's an important tool in your health toolbox.
You bet. Like when was
You know?
I often reflect and I use this analogy. When was the last time I actually went into a bank and stood in a line and actually did a transaction with a teller? Like I think I was, I don't know, a teenager. In terms of
Yeah.
it's become completely commonplace to do it with my phone. And now with
Yeah.
touchless banking, I don't even have to take my wallet out. I could just have my phone with me, and the
I'm
convenience.
not there yet.
You're not there
I want
yet?
you to know I am not there yet with touching my phone to anything for money. That sounds dangerous for somebody like me.
There's
But
limits.
it's funny.
You can put a
I
limit
know,
on it.
right? Baby steps, baby steps. But it's funny because I remember when online banking came in, Juggy, and everybody was like, "Whoa, put the
Stop.
brakes on!
Yeah.
This is too much. This is
Right.
too dangerous." And now you're right; it's just commonplace. This is what we do. Let's just, as we're wrapping up here, let's just talk about COVID-19
Okay.
and virtual care.
Yep.
We're many of us are in isolation. We're
Yeah.
following the protocols that have been put in place, and we're trying to stop this from spreading. What are there with virtual care? Are there things that we can do? If I thought I had COVID-19, is there something I can do with
Yes,
virtual care?
absolutely. So, download the app, use our artificial intelligence symptom checker. It's designed to make sure that we can recognize things that are COVID related, and you can use that service. You can see a doctor right away if you want to talk to somebody and go through your symptoms, and you can book an appointment, and you can get an appointment with one of our doctors within minutes. And so you can see them. And of course, at no charge to you, right? Like there's no cost associated with these, with our virtual care solution. You can go and do that and put your mind at ease and make sure that you've got somebody that is a professional. It's a person, right? It's a locally licensed doctor that's going to help you. And you can do that after hours. You can do it on weekends. You can do it on holidays. So whenever you need it, it's there for you. And we also have a home health monitoring solution. We partnered with the BC Ministry of Health and all the health authorities across the province, Tamara, to expand our home health monitoring solution that I talked about earlier, so that it can help people who are dealing with COVID-19 to be recovering at home, but still being connected with doctors and nurses, but recovering through the safety of their home. And so again, we give them the technology, we give them the mobile device, the tablet, etc. And then we track their symptoms with them and connect them to doctors who can monitor them safely while they're at home. And we've done just under 500 people in British Columbia with this COVID-19 home health monitoring solution to date.
Wow, that's amazing. Well, listen, thank you so much for taking the time to chat with me. I really appreciate it. There's tons of good information here, and it really, the bottom line is we all need to be our own health advocate, and really, this is the way to, like we said, right, another tool in our toolbox to help us along the way. So we really appreciate your time.
Thank you, Tamara. And I think there's never been a better time where our collective intellect has to be matched with compassion, because we will get through this. And I think we need to take care of each other along the way. Thank you for everything that you're doing, Tamara, to help spread the word.
Oh, thank you. Okay. And remember, you can visit telus.com/health for more information or download the Babylon by TELUS Health app today at any app store. And be sure to join us here on TELUS Talks with Tamara Taggart every Tuesday and Thursday.